I'm Warren Holshouser, one of the cardiac electrophysiologists, and this is Ms. Nancy Lee, nurse practitioner. And we are two of the providers you may encounter at our Sanger Heart and Vascular Institute AFib Center of Excellence here at Atrium Health. This 10-minute instructional video is to introduce you to atrial fibrillation and is titled, What is Atrial Fibrillation? The goals of this 10-minute video will include a definition of atrial fibrillation. We're going to review some of the common symptoms associated with atrial fib. We're going to go over some of the potential causes and associated conditions that are often present in our patients with atrial fibrillation, and finally introduce you to the basic evaluation in early phases of treatment.
So what is atrial fibrillation? Dr. Holshouser, what do you tell patients when they have atrial fibrillation?
So atrial fibrillation is an abnormal heart rhythm or an arrhythmia. And for most patients, it's a condition that they present with due to symptoms of breathlessness, and we'll talk a little more about that later. But it's a condition that results in the heart beating in a non-coordinated fashion. So with the diagram we have, which shows normal rhythm, the top chamber beats first and the bottom chamber beats second. And it does this in a very regular fashion. In atrial fibrillation, the top chamber is completely chaotic. And that causes the bottom chamber to try to keep up with it, which makes the heartbeat very irregular and typically fast. Now there's a condition similar to AFib called atrial flutter, where the top chamber is a little more coordinated but still very fast, and it causes the bottom chamber to beat fast. Then it can fool patients, it can be very regular. So we try to define atrial fibrillation basically in its disease state progression, meaning as you have it more, it often progresses. In the early phases, most patients are in intermittent AFib, and we call that paroxysmal atrial fibrillation. And that's AFib that the patients go in and out on their own and lasts usually less than 7 days, but in some patients it's minutes to hours. Then persistent AFib is when the patient has gone into AFib and stayed there for over a week. And they are not likely to go back to normal rhythm unless we do an intervention. Long-standing persistent AFib defines AFib greater than a year in duration. And those patients are going to be harder to get back to normal. And finally, permanent AFib is AFib that somewhere along the way we have deemed is not a rhythm that we want to put back to normal. And there can be lots of reasons for that. Advanced age, other comorbidities, or structural changes that would make maintaining normal rhythm very difficult.
Dr. Holshouser, what are some of the symptoms of atrial fibrillation?
So atrial fibrillation can have a lot of different symptoms in a lot of different people. So the first thing I'll tell you, some people don't even know they have it. And to the people that have it, that it drives them nuts, they're always amazed when they hear that. But the most common symptoms are palpitations, or what I'll say is cardiac awareness, or feeling your own heartbeat that feels different than normal. It's often fast, and so people experience the sensation of racing heart rate, and then a lot of other things that are due to that racing heart rate. Shortness of breath, some people have chest pain or chest tightness. A lot of patients will notice a decrease in their stamina or their exercise tolerance, and they'll be breathless doing things that they were able to do pretty easily before. Some folks will notice that they're putting on fluid or weight gain in their ankles or swelling. And then you can even create other things such as lightheadedness or dizziness. Now what I've described to you can be the symptoms of a lot of other different conditions. So the symptoms aren't necessarily specific for AFib and can also represent other conditions. But these are probably the most common things that the patients will complain to me about.
Thank you for letting us know what the symptoms of atrial fibrillation are. So what are the causes of atrial fibrillation?
So the causes of atrial fibrillation vary within our patients, and that's perhaps the big question that everybody has when they come into the office. Why do I have this? What have I done? What's wrong with me? So the first thing I try is to reassure folks. Atrial fibrillation is common. It's the most common arrhythmia we see in adults. And the most common reason they have it is getting older. They're not old, they're getting older. And so age is a big association with atrial fibrillation, and we have an aging population. But after age, the other associations that are very strong include high blood pressure, heart disease, and sometimes people don't know they have heart disease, and this is an opportunity to diagnose and intervene on it. Heart failure, thyroid problems, sleep apnea, and sleep apnea is also strongly associated with being overweight. And a lot of our patients have gotten heavier, and again, an opportunity to intervene on that will help us in evaluation and treatment of their atrial fib. And then there are things that people take in or eat. Alcohol has a very strong association with AFib, especially alcohol in excess, but it also contributes to hypertension, so it's more than one cause. And then caffeine. Caffeine is associated with AFib loosely. It's not as strong as some people think. But again, a history and trying to discern if people are taking in too much caffeine is really important when we're evaluating our patients with atrial fibrillation.
We have people coming from various areas to AFib Center of Excellence. So what are some of the things they can expect when they're seen in the office by you?
So, we get people with AFib from lots of different places. Some folks have found it themselves with all the home monitoring apps. Some folks have shown up in the ER. A lot of folks have been seen by their primary care physician and had a monitor placed. And then there are some patients that have been referred to us by cardiologists who have had atrial fibrillation but want additional treatments and therapies. So the first thing you can expect is a detailed history of your atrial fibrillation, how it was found, why it was found, and how it's affecting you, and a physical exam to go with that. For our patients with a virtual encounter, those tend to be folks that have been seen and evaluated in some way by someone, and we can still make a really good evaluation in most of those patients just based on a lot of the data that we can collect ahead of time. But after a detailed history and physical, most patients will have an electrocardiogram if they haven't had one. Most times the diagnosis of AFib was made with an electrocardiogram unless it was made on a monitor. Some type of monitoring is fairly standard for our patients with atrial fibrillation. Now, you may have already had one before you get to see us, and we do not necessarily repeat one just because you've had one. But for people with symptoms, we'd like to make sure that the symptoms are in fact from atrial fib. A standard for all patients with a diagnosis of AFib is in a cardiac ultrasound called an echocardiogram. And this looks to show that your heart function, how well your heart functions, whether you have valvular disease, and it gives us some good measures of your atrial sizes and helps us to tailor a treatment for you with respect to antiarrhythmic drugs or ablations, or maybe no therapy, depending on what the current situation is. And then there are some other advanced therapies that may come along the way, or diagnostic imaging. But though I would say the basics to start with would be those things. And then a follow-up to evaluate whether or not additional therapies are merited.
So when people come to see us for the first time, what can they expect as far as treatment goes?
Great question. So you can imagine the treatment of AFib is going to vary a lot from how long you've had it, how bad it causes symptoms for the individuals, whether or not they've had various ablations or meds or other treatments. So therapy is going to be individualized. But for patients with a new diagnosis of AFib, once we initiate some basic testing, we focus on three things for treatment of atrial fibrillation. Number one, and this is why most patients go to the doctor, is we want to make people feel better. We want to improve their quality of life and improve their symptoms. Second is we want to protect the heart. And what I mean by protecting the heart is there are some patients that won't even know they're in AFib, but if their heart's going really fast for long periods of time, it can cause damage to the heart. So we want to protect the heart, and we do that by initiating therapies that slow the AFib down or even convert it to normal. And finally, we want to protect the brain. AFib is a very, very strong cause of stroke in this country. And for patients with atrial fibrillation, the majority will end up being on some type of blood thinner, but not all, depending on their age and various risk factors. So in summary, we want to make the patients feel well. We want to protect their heart and protect their brain. So you can, at the first encounter, we will address all three of those. Now, initial therapies may involve pharmacologic therapies or medicines. And then there are various steps along the way and things that you've heard about, cardioversions, ablations. These are all tools in the toolbox that may or may not be appropriate for you, but may be appropriate later in the course of your AFib. So I hope this video has been helpful. Obviously, you're someone who's interested in AFib or has a family member with atrial fibrillation, and I recognize this can be a scary time for you. I want you to know that Nancy and myself and our whole AFib Center of Excellence at Sanger Heart and Vascular at Atrium Health is here to guide you through this journey of AFib. And you can recognize that your journey will be unique than other people's journeys. And whether or not this involves medications, cardioversions, ablations, pacemakers, all sorts of other things that can be involved with AFib care. In summary, you're watching this video probably because you or a family or friend has atrial fibrillation. And I would like to reassure you that our team here at the Sanger Heart and Vascular AFib Center of Excellence at Atrium Health is here to walk you through this journey. Whether it's our providers, our nurse practitioners, our nurses, and our nurse navigators, we are here to make it easier on you. And whether that involves medications, ablations, further education, or perhaps really no change in therapy, but managing you chronically, we're here for that. There will be some other videos that will be complementary to this that I hope you find valuable, and we look forward to seeing you.